Doctor, what has been your experience when it comes to the effectiveness of carbetocin versus oxytocin for the prevention of postpartum hemorrhage?
See, the as far as the effectiveness is concerned, both our study and our champion study also has shown that the carbetocin is non-inferior. But the what I just want to bring to your notice is that this effectiveness matters especially with the room temperature stable carbetocin, because the temperature varies all throughout the world, and especially so in India and in Karnataka or even South India, the temperatures are in the range. Sometimes even northern India also, it goes beyond 40, 50. So it is important because, and you have also seen that in some time back, government of India also did this potency and oxytocin effectiveness in some of the institutions, which proved that many of them have already lost their potency. So the room temperature stability with the equal effectiveness compared to oxytocin makes carbetocin a very effective drug. And you don't have to keep it in the refrigerator. Anytime it can be taken out and can be given, because at 30 degree, at 40 degree, at 50 degrees, the potency remains for a different period of period, the active drug, because with 30 degree almost more than 2 years, you can say that it is 6 months to 2 years, it is quite potent, whereas oxytocin cannot remain in such temperature. So, and the effectiveness, of course, it is one of the good oxytocin, and it is comparable to oxytocin, and that is important. And more important than that is effectiveness matters because this drug acts longer, and because it is not amenable to two of the enzymes which they make it inactivated, the oxytocin, but that cannot act on this sulfide and the amine group, they are being changed in this, and that makes this drug more potent because it acts for longer time, and that prevents us from using drip, which we need to add in IV oxytocin infusion. So if you give this IM, you are rest assured with the contractibility effect of this for next 2 hours. And that is the first 2 hours after delivery matters in woman who has delivered, and that is a dangerous postpartum hemorrhage. So that's why I find that this carbetocin, I'm not biased to this drug, but mechanism and action of these drugs and the availability, ease of its use can make it more effective, and its duration lasts longer, and infusion can be avoided, and its associated complications can be avoided, and that is how it proves superior over this oxytocin. Its lipophilic effect, it dissolves into the lipids, and that's why it can act longer. That is the another reason why this drug is long acting. So this adds to that, and these are the advantages which an obstetrician or a person who is conducting delivery, even a midwife can give this drug. And there is no need to go and keep it in the fridge. Even if it is kept in the fridge, if the temperature and electricity is not there, that temperature may not be maintained in those. So that is why room temperature stability, because that room temperature stability is because of alteration in the excipients, not in the molecule of the drug. So the excipients change, bring this room temperature stability, and that is the important thing which makes this drug equally effective, but ease of use, longer duration of action, and that's how it is more, I feel, effective.
Could you mention about your experiences related to the additional need of uterotonics, uterine massage, and blood transfusion with carbetocin when compared to other uterotonics?
See, since last July it has been launched in from Belgaum, we are using regularly for both vaginal delivery as well as for the cesarean section. I'm very happy to share here that our infusions use of additional oxytocin, the prostaglandins we are not using now. Even additional use of oxytocin in drip has been tremendously reduced. So almost during the C-section and in vaginal deliveries, hardly we have used now after this from July oxytocin in drip. Please understand, if we give oxytocin in drip, higher dose, 20 to 40 units, it has an antidiuretic effect, which again causes urinary, there is a reduced urinary volume, which may add on for the complication, like, which may cause sometimes pulmonary edema, which we have not been able to identify in some women who are compromised with their cardiac function or other reasons. So we find that if you use this drug, wait for 1 minute. That what we do is you give this drug, and with 1.2 minutes the onset of action. So what we give is, we, as soon as the baby is born, we ask the other assistant to give this drug intramuscularly, and slow delivery of the placenta. This is very, very important, because if we deliver slowly, we take around 1 to 2 minutes of time. By then, the carbetocin action has already come in, and the uterus contracts well. And this, I have additional uses of procedures also have come down, like, B Lynch procedures, Heyman's procedures also have come down since we started using this drug.
Doctor, any additional points of views that you would like to share regarding the use of carbetocin through your experience of so many years with using this drug?
When though the symptometrin is number one drug as far as the prevention of PPH or treatment of PPH is concerned, but the side effects associated with symptometrin are more. So here we do not find the side effects which we have not observed here. There are some limited side effects which can occur with any drug to any individual, which is very difficult to predict. But most of the time, we have not experienced any side effects with the patient. And this is a very important point I just want to mention. And there is infusion. You imagine you have to have a drip, IV fluids, give this, monitor, and also see that whether urine output is adequate or otherwise. These are the other things which we don't have to worry with this particular drug. However good the uterotonic is there, there are some cases, but definitely atonic postpartum hemorrhage can be definitely reduced or prevented with this drug. And that's the message I want to give. And another point I want to, I know it is expensive drug. It is 360 to 490. Different companies have got different amount they have, but it is worthwhile if you look at the infusion related, duration related actions and other monitoring advantages. So that scores over that, and I feel that taking all those into consideration, this amount what we are paying for this drug, it is worth the while, because every drop of blood counts, and our women are anemic, and these women should not lose further blood. And with that, if we are able to save these women as well as their bleeding, I think it is worthwhile, and that cost should be taken care. And also that depends on how we are concerned about this. And that is where, if we are concerned about a woman, we should definitely use this drug as a first line drug in India, because we do not have symptometrin. And symptometrin there are contraindications with that. I conclude, and I thank every one of you.